Pediatric cases of COVID-19 are climbing throughout the U.S. and the world. Over the last week, we've seen a 64% increase in the number of cases, where it's over 325,000 pediatric cases of COVID-19. We are also seeing an increase in hospitalizations, up to 66% increase over the last week. There's been a 66% increase in children who are being hospitalized across the nation, and that's true here in Chicago as well. Some of the things we're seeing about the children who are coming into the hospital, they are usually either under 5, which is they are ineligible for vaccine, or they are older children who are still and have been unvaccinated throughout this pandemic. We are not seeing significant percentages of vaccinated children in the hospital. It is always best to get a COVID-19 test if you can. This is helpful because then you know that your child has COVID-19, how long that they might be sick, and how long you need to keep them at home. If you think your child has COVID-19, it's best to call your doctor. Sometimes your doctor will tell you to do something like a telehealth visit or to monitor for certain symptoms. But certain things that you'd want to watch out for would be high fevers, if your child is having difficulty breathing, or perhaps your child is not eating well and is starting to become dehydrated. Those would be serious reasons for you to think about bringing your child in to be seen by a doctor. There are other respiratory viruses that we are seeing at the same time, so it is best to try to get a test, whether you can get a home test or you can go to your doctor's office and get one of the tests there or at a free clinic. It is best to try to get a test if you can. Some doctors may tell you to monitor for symptoms at home. What you can do to protect your child from getting COVID, number one, is get yourself vaccinated and anyone in your household who is eligible for vaccine to get vaccinated. If you all are already vaccinated, it's time to get boosted if you haven't done that yet before. Because the most important thing to recognize is the children who aren't eligible for vaccination, such as the children under 5, the only way that you can help protect them will be to protect your household and your friends and family from spreading COVID-19 to your child. So in addition to getting your vaccine, you want to make sure that you're wearing your masks when you're out and you need to take your child out, and that you're trying to keep social distance, so 6 feet of distance in between you and others. Try to also during this time limit the amount of visits that to what you need to do, and then make very conscious decisions for whatever's best for you and your family for get-togethers and gatherings.